Hello everyone, welcome to you all. Myself, Dr. Saurabh Kose, working as Head and Associate Professor, Department of Pharmacy Practice, ISF College of Pharmacy, Moga, Punjab, India. Today we are going to discuss about the community pharmacy services, which is three-fourth in the Indian population and worldwide when it comes to the services of the patients. So community means people's populations are the subsets of the people's nearby residential areas, shopping malls, schools, playgrounds, community centers, streets, and other mass areas. So where the medicine services, pharmacy services are being given in the community, it's called as community pharmacy services or medical stores. So India is a developing nation that is home to over more than 1.40 billion peoples and is home to 16.7% of the world's population. So there are more than 80,000 pharmacies in India and about 60,000 distributors. So the market, which is valued about 950 billion in 2025. So the pharmacy practice in India can be tracked back to British era when allopathic drugs were introduced and were made available through drugstores towards the end of the 19th century. First community pharmacy in India was established at Calcutta in the year 1811 as chemist shop. And in 1820, the chemist shop developed into the apothecary shop. Historically, the general practitioners and the community pharmacist have a common ancestor called apothecary, the advisor on health and dispenser of medicine. So this is the interior of the apothecary shops. In 1901, establishment of the Bengal Chemicals and Pharmaceutical Works, Calcutta by Acharya P.C. Ray. And in 1903, a small factory at Parel, Bombay by Professor T.K. Gujjar was established. In 1907, Alembic Chemical Works at Baroda by Professor T.K. Gujjar was established. The pharmacy practice scenario, and especially community pharmacy practice during pre-independence era, was highly unregulated, and there were no restrictions on the practice of the pharmacy in India. In absence of any restrictions on quality of drugs imported, manufacturer abroad took advantage of the situation, and the consequences were following. Foreign manufacturers dumped inferior quality medicines and adulterated drugs, whereas the market were full of sort of useless and notorious drugs were sold by the unqualified men. So the practice of prescribing dispensing was normally functions by the doctors. In addition, most doctors or physicians trained their clinic assistant to dispense medicines and assist in the compounding of medicinal preparations. The assistants were popularly known as the compounders, whose status, functions, and the duties were ill-defined and improperly understood. For regulating pharmacy profession, Government of India in the month of August, 11th August 1930, appointed a committee under the chairmanship of late Colonel R.N. Chopra Sahab. The committee proposed three important points: to start Central Pharmacy Council, to start Central Drug Control Department, and to start Central Drug Research Institute. In the beginning of the 19th century, various acts are announced for the regulation of pharmacy profession, such as in 1919 Poison Act, 1948 Drugs and Cosmetics Acts, 1948 Pharmacy Act, 1948 it was published. In 1948 again, Indian Pharmacopoeial Committee was constituted under the chairmanship of late Dr. B.N. Ghosh. In 1949, Pharmacy of Council of India was established under Pharmacy Act 1948. So it is necessary to improve the quality of practice, pharmacy practice, and community section on professional skills in India. India is becoming fast developing nation in the world where major exporters to Africa, Europe, and various other countries like US in generics are done. So in India, there is a major transformation in drug research, development, production, marketing, formulation development, research and development, community pharmacy services, etc. But the thing is that there is no community connection. Hence, community pharmacy plays a vital link between the industry and the common medicines as a vital link. So, on a general view, when we go to a community shop abroad, it looks like Vice. So, very like a forecasted five-star hotel or hospital look it will come. But the community pharmacy provides healthcare facility that emphasizes providing pharmaceutical services to a community. Typically, a registered pharmacist dispenses medicines from the community pharmacy. For the prescriptions, who is a community pharmacy? Now the question arises. So a community pharmacist is a healthcare professional who focuses on the patient's drug therapy, while a physician prescribes drugs and the nurse administers them, and the pharmacist is the drug expert. So in patient department, no doubt nursing staff is the one who take maximum care of the patient. When it comes to the outpatient department, pharmacist is one who is taking maximum care of the patient. So the pharmacists are there for the following purposes: improving compliance, drug selection, education, improve outcomes, formulary management, medication management, all the parts. The pharmacist expertise lies in how the medicines are used and how to be used, like in asthma case, meter dose inhaler, Rotacap. In diabetes case, how insulin has to be used. And to maximize benefit and minimize adverse effect of the drug therapy. So as the benefit and risk calculation has to be done on the balance. Then how prescription drugs interact with other medications. So the pharmacist's primary role is dispensing, compounding. Pre-compounded products are nowadays available from the pharmaceutical companies. What is the role of pharmacist? Pharmacist's role is vocal role to ensure the safety, efficacy, quality of the pharmaceutical care or patient care in an appropriate manner, telling patients about the harms, about the storage, about the contraindications, about the adverse effect, about the drug-drug interaction, food interaction, timing, dosage scheduling, etc. are the various parts. So, what a community pharmacist can do: managing minor illness by providing information to patients on self care and non prescription medications, and to demonstrate the proper use of an asthma inhaler or an insulin pen, help patients to manage their diabetes, and clients can also talk to their pharmacist about how to store and take medications, what foods or activities to avoid, what to do if a dose is missed. Working with the patients, physicians, nursing staff, dietitian, physiotherapist, so paramedics and medics to care providers to help patients for achieving their health goals by improving the quality of their drug therapy, ensuring safe, secure, effective distribution of medication, taking medication histories, managing patient drug profiles, monitoring adverse drug reactions and patient adherence with their drug treatment, assessing patients' drug therapy for possible interactions with suitable medications and health conditions, making recommendations to the prescribers, other healthcare professionals as far as the standard treatment guidelines are concerned for the adjustment of the patient real-time drug regimens to enhance the quality of care, providing education to patients, caregiver on proper use of medications and medical devices. So here in India, community pharmacy includes all of this establishment that are privately or publicly owned and whose function in varying degrees to serve society's need for both drug products and the pharmaceutical services. For a common man, community pharmacy, often referred to as retail pharmacy or retail drug outlet, is a place where medicines are stored and dispensed, supplied, or sold. The general population usually calls community pharmacies as medical store. So, the community retail pharmacy sector is the prime source of medicines for both ambulatory and hospitalized patients, minimum stock in many hospitals. In many developing countries, private community pharmacies are often seen as a source of inexpensive medical care. So, India is of no exception because private pharmacies offer on the first and the only source of healthcare for a majority of patients in India. So, coming up onto the community pharmacy services, the pharmacist should be qualified and a registered pharmacist by the State Pharmacy Council, who is only the person who is legally authorized to dispense medicines in the community pharmacy. Registered pharmacist is one who passed a diploma, degree, master degree, or PharmD from a Pharmacy Council of India approved institution and registered in a State Pharmacy Council. The pharmacist registered under the following clauses: Clause 1 and Section 2 of the Pharmacy Act 1948, and their presence is legally required during the dispensing and selling of medicines according to the Rule 6515 of the Drugs and Cosmetics Act 1945. And the public thinks the perception of community pharmacy and the pharmacy is very weak. The general population considers community pharmacies as drug traders, or obviously not better than the general store owners. The educated people consider the retail pharmacist as a person who has acquired a drug license to supply the medicines, or a grocer who deals in medicines. In India, consumers or patients' expectations from community pharmacies are that the medication should be effective, safe, and affordable. expectations from Indian pharmacists would be to dispense the drugs according to the rules with the proper advice on how and when the medicine should be taken and what to do in the case of adverse drug reactions, as well as the provision of advice on common ailment. In India, in majority of community pharmacies, one gets a sale rather than a professional service. For professional services, the pharmacist wear a uniform white coat number, give advice to the patients who ask for it, work quickly on computers to generate bills, offer service to regular customers that include reminding about purchase of regularly used prescription medications, and particularly a pharmacy, when we enter, particularly a board where air condition is placed, refrigerator is there, dispensing counter, this is the one of the place, this is for the medications. So good pharmacy practices or the medical store management, maintenance, daily routine, quarterly, annually, then medication audits and safety audits and physical inspection and various kind of one to day-to-day activities are done in a community pharmacy, and waiting zone and health screening services, ambulatory care services, and patient counseling area, and fire extinguisher, closed circuit camera for the theft, anti-theft protection, and lighting and uniformity of the prescription medication assistant, their wages, salary, apprentice pharmacist, a lot of things community pharmacist has to do in the public sector. So we what we receive a pharmacist in the community with a white coat with a small plate on his coat declares his name, position, his registration from the Pharmacy Council of India should be displayed at one plate, and he reviews advice on how each medicine is to be taken and on possible side effects. He prepares the bill with the computer and receives the payment. He smiles and thanks, and we are out with the satisfaction that our healthcare is in good hands. And in this, we can imagine that we can materialize in India in the coming year. But what is the reality? Reality is something different. The medical shop is also like another shop, is lining the payment and is exposed to the fumes and effluents that are filling the road. All the patients are learning on the counter and vying to get the attention of the pharmacist and salesmen. Everyone is in a hurry. There are a lot of 3 or 4 persons making everyone entertained about the business and giving medicaments, and you're not able to understand as far as the cash counter is concerned that unfortunately who is pharmacist and who's not pharmacist. So a lot of you can see there is jugglery. So in this case, this is unfortunate. Whereas the population density is concerned, India consists of various biodiversity places, and it is one of the one thing where we can say that every pharmacy store there is no such kind of pharmacist available. So certainly that 90% of pharmacy you will not find a pharmacist over there present. So that is what one of the we would say that unfortunate thing is happening in India. Many people ask for medicine without producing a prescription and get them without any difficulty. Nobody bothers about whether the drug in questions belong to Schedule H, H1, or antibiotic or other prescription drugs. Interestingly, antibiotics are given even for one day also. So there is no prophylaxis or no sensitivity for AMR, antimicrobial resistance, or no prescription audit is done. And the mistakes is more often done by people who look like educated peoples. And peoples come to the shop and tell the pharmacy salesman about their health problems, and the pharmacist or the salesman dispenses the medicine for his or her choice. So the pharmacy profession has been making attempts consistently and strongly in the past 3 decades to imbue the sellers in the medical shops with professional values and transform the medical shops into community pharmacy. Pharmacy Practice Regulations 2015 came by Pharmacy Council of India, where the practice of pharmacy, code of ethics, interpretation, evaluation, implementation of medical orders called as prescription, written medical order, dispensing of prescription drug order, participation in drug and device selection, drug administration, drug regimen reviews, and drug or drug research, provision of patient counseling, and the provision of those acts or services necessary to provide pharmaceutical care in all areas of patient care, including primary care.
Responsibility for compounding and labeling of drugs, devices, proper and safe storage of drugs and devices, and maintenance of proper records for them. So, Pharmacy Practice Regulation Amendment came in 2021, then came in 22 also. So, Indian Pharmaceutical Association Good Pharmacy Practice Guidelines are there in 2002. In 1992, Federation of International Pharmacists gave a guidelines for good pharmacy practices. So, in a nutshell, India faces massive challenges in providing healthcare for the vast and growing population. Despite many barriers, community pharmacy services are central to the safe and effective medicine management and advancing health. With rapidly occurring changes in the healthcare delivery and growing patient expectations, it is hoped that community pharmacists services will change definitely in the upcoming time. So, community pharmacists are the various job providers to the other pharmacists. They do health screening services, education. They are the primary companion to the society or the community regarding the first aid measures, health screening services, or for the acute situations, general medicine and over the counter medicines are being given by them. So, ladies and gentlemen, thank you so much for watching this session.